Hello, I'm Dr. Joshua Betterson. I'm professor and chair of the Department of Neurosurgery at the Mount Sinai Health System.
Hi, my name is Isabelle Germano. I'm professor of neurosurgery, neurology, and oncological sciences in the Department of Neurosurgery at the Icahn School of Medicine at Mount Sinai, New York.
We are here today to talk about brain-computer interfaces as part of our participation in the Aspen Ideas Festival. And I have a series of questions for Dr. Germano, who is one of the pioneers in the use of computers in computer-guided neurosurgery. So, Dr. Germano, can you explain what computer-assisted brain surgery entails and how computers are used to guide surgery?
So we've been using computers to guide us for many years. And this is not just for brain surgery, but for many other things that we do. When it comes to brain surgery, I think what is difficult to comprehend is that the brain is different from person to person. And we can see the brain, in a sense, as a tangle of wires, and how to really understand where each wire is going to and from is complex and complicated. And computers can really help us understanding that, and by so doing, then can help us navigating when we perform surgery and or when we try to restore function.
Can you explain what is meant by navigating?
Yeah, so we use this term a little bit out of context. Navigating is used for sailing, for taking a boat into the ocean. Magellan did that when he went around Africa and found a new passage to India. So we consider navigation anything that is directing us in the direction to find what we're looking for. And what are we looking for in the brain when we perform brain surgery? We look for two things. Usually we look for something that doesn't belong to the brain and we want to take out, like a brain tumor, and we look for something that we want to preserve, the function that we want to preserve.
So would that be an example of how a patient might benefit from use of computers?
That would be, I think that when patients come to surgery, we always tell them that at least for brain tumor surgery, which is what I do, we tell them that the goal of the surgery is twofold. We want to remove what doesn't belong to the brain, but we also want to be sure that their function is preserved. And the brain, even with the tumor there, doesn't look that different than when the tumor is not there. And so what a computer can do for us is giving us that additional look and that additional understanding of what to remove. And most importantly, can give us the understanding of the surrounding of that tumor and where the circuitry is residing and how not to interfere with that. And so a patient then will go through the surgery with the maximum possible resection of that tumor. And at the same time, that resection is safe, meaning that that person did not have to sacrifice some of their own functions to receive that great removal of the lesion.
Can you explain in a little more detail how the computer will help you avoid those critical structures? How do you actually use the computer to do this?
So the computer can be used before surgery, during surgery, and after surgery. And before surgery, we want to see the images, not just generic images, but the images of that particular patient. And over those images, we want to overlap where the crucial areas are, and we can also draw lines and maps of where the tumor is. At the time of the surgery, the computer interface is usually based on direct cortical stimulation, and now we're moving into a new era where that intraoperative time that is spent in by the computers understanding all those functions can be extrapolated ahead of the surgery with transcranial magnetic stimulation that is also navigated. And then after the surgery, how is the computer helping us? Well, if there is a temporary loss of function for that particular surgery, or in other patients there have been no surgery whatsoever, but they had an injury such as a stroke or a head trauma, then the computer can help us stimulating exactly where that function is lost and helping with the plasticity of the brain and getting that plasticity back and some of those functions restored. So 3 phases of the use of the computer: before, after, and during surgery.
Interesting. So with how far we've come and how advanced things are now, where do you see us going? What's next?
We are at a point where I think the limitations are basically vanishing in front of our eyes because of the computer technology and the artificial intelligence. So both you and I remember when we had the BlackBerry and we were pushing on all those buttons, and when the iPhone first came out and we say, wow, look what the iPhone can do. And nowadays, I don't think that there is anyone that is without an iPhone. And the reason why I'm using this example is because with the computers, now we can decode a lot of big data that before we were not able to do. And it can be done super fast so that it doesn't take the time anymore that used to go into it. And also because I think that some of the devices that we're now implanting in the brain to accomplish some restoration of function and or facilitating some circuitry, most likely all that data that we're collecting today in our operating rooms, in the next, I'm optimistic, I would say in the next months or couple of years, we're going to be able to have all that data available to us and being able to apply that knowledge to many more patients. And so I think that where I see the technologies going is from being just a niche opportunity to be really broad-based and to be scalable to all the 2 billion people that now are in the United States, just to mention one country, that suffer from a disability that is not allowing them to move, to speak, to hear, or to see. So I'm very optimistic that computers not only are here to stay, but they're here to help us.
Well, thank you so much for chatting with me. Really interested to hear your perspective on the use of computers in modern brain surgery.
Thank you for having me. This is really exciting, and it's really nice to be here and to be surrounded by brilliant people. Thank you.